Ladies and gentlemen, it is my pleasure to welcome my friend, Dr. Mark Ghaly, to the stage as our 2020 MLK Health Champion.
What a tremendous honor. I'm very grateful. I remember when I first arrived in Los Angeles, some of you met me and said, what experience do you have in South Los Angeles? How are you going to participate in this really complicated conversation of bringing health equity to a neighborhood that's so diverse, ever-changing, and really in the throes of what was that closure that many people worried we would never get to this day. And I did what any good physician would do. I went to the patients that we have the privilege to serve and started listening, asking questions, and understanding what the community wanted out of a new MLK Health Campus. And what you have today, I think about the tremendous leadership of Supervisor Ridley Thomas and his incredible vision for what could be. Not just shuttered old buildings, not just vacant plots of land, but places that not only brought jobs and healthcare services, but deep compassion and hope to so many people who needed it. I'm grateful that we are not just here talking about a hospital. We're here to celebrate a campus that has so much more. An outpatient center, a recuperative care center that provides hope and compassion to people who we often welcome into our hospitals, but have them leave without a place to go and recuperate and a place to stay. The behavioral health center that is planned for the future that really becomes this beacon of commitment to this notion of integration. We know that 15-minute visits, primary care focus isn't enough for people who live complex lives and face poverty and an increasing economic crisis, not just health issues in Los Angeles and in South Los Angeles in particular. And being able to create a center that's going to bring what we know is needed in substance use disorder services, healthcare services, and mental health services together under one roof is truly transformative. And although I had the privilege to represent the county in those long-hour phone calls with Manny Abascal while he was in Asia figuring out how we do this, how do we make the money work, how do we make the building receive its certificate of occupancy, all of those fun, sticky details. We had a board of supervisors and a leader in South Los Angeles in our supervisor who continue to say we can and push us forward. When we didn't know when the next step would be taken or where the next step would lead us, I think we came together and believed. And I think about this heroic and innovative public-private partnership. And the P that I most focus on is that partnership key, right? It is public, it is private, but it was true partners in a vision for health, equity, and a belief that we could do more. I think back to lots of 8 a.m. calls with Elaine, driving in with one of my young children. I have the privilege of raising 4 of them, in the back screaming at me while I tried to talk to Elaine about what we needed to do to get the MRI or the CT up and how the county was going to participate in supporting the hospital and the board to make that happen. And all of those minute, small decisions have really led to this vibrant place that today in my role as Health and Human Services Secretary under Gavin Newsom, our governor, really I carry this campus with me every single day. It screams out hope, commitment, compassion, integration, innovation in ways, and I said this a long time ago, Mr. Supervisor, there is no place like the MLK campus in the United States that is focused in a community that has so many tremendous challenges, so many wonderful opportunities, and so many gifts, but to come together and bring all of these services on one campus, really soups to nuts, really this community continuum. There is nothing like it, and I think it's a model not just for LA, yes. A model not just for Los Angeles, not just for the state of California, but one that I insist seeing across the country. I would, as much as I appreciate an opportunity to look back at this wonderful achievement that I had a small part in playing and making reality, I think about our future and I celebrate the wonderful work that the hospital does today. And I am grateful for the leadership and wisdom of this hospital, the board, Dr. Batchelor, the many physicians who insist that although the emergency room will continue to provide tens of thousands, even hundreds of thousands of visits a year, what that is indicative of is a lack of what we need in South LA, which is more primary care doctors, more specialists on the outpatient basis, and moving way beyond just the acreage at the campus, but throughout the entire community. And I know that is part of the future. That is one of the key priorities. But I look forward to the day when we celebrate not the emergency room being the focal point, but that we have this tremendous set of resources so patients can go and receive that primary community care that we know makes a difference. I would also miss the opportunity to use this stage. Mayor Steinberg was here. I think Supervisor Ridley Thomas has been, they together have teamed up with the governor to really bring clear focus to what I think is one of our most important humanitarian crises, a real emergency in our state, is the fact that over 150,000 people are counted as homeless in our state. That in LA County, some 40,000 people are unsheltered. We drive by them under freeways, as we drive up to work, as we leave our homes. And we know that disproportionately, they're brown and black. They're suffering and income inequality second to none. And despite our great prosperity in this county and in this state, we continue to have this urgency around this problem. And I just want to say a deep thank you to Supervisor Ridley Thomas, the county, Mayor Steinberg, our governor, for really leaning in on this issue. And although it took us decades to get to this point, I think with some urgency and meaning, we are going to lift up housing as health, food as health, and really work together to make sure that we turn the tide on this incredible problem and challenge. And if ever there is a time to believe, as we heard the supervisor quote Martin Luther King Jr., that we have faith that the next step will come, this is that issue for us. And as I implore you to consider this, as our governor spoke about over this last week, as I joined him on a statewide tour of homelessness and behavioral health across the state, and understanding what we can do as a group of leaders, policy leaders, fiscally responsible to California. I think where he was most eloquent was how this has to be an all hands on deck effort. And everyone in the room has a role in this. Everyone who works with you has a role in this. And it's really this tremendous show that California is not just leading in technology, not just leading in medicine, not just leading in so many other arenas, but we are the leaders in solving some of the stickiest problems that come our way. And so I look forward to continuing to work with the county, with the city, and representing all of you as your Secretary for Health and Human Services at the state.